Hi, I'm Dr. Johnny. Today we're doing a quick tip, quick clip on PDO threads. Because PDO threads, when you put them in, there's no dissolver for them. It's really important that they be put in properly. And guess what? It also depends what you're putting in there. Believe it or not, let's get started with Raji's quick clip in 3 seconds. So thanks for joining me here, and remember, if you like these videos, click subscribe, hit the like button. It really helps pop up these videos, and we can do more to help you with your practice or with people who are getting treatments. The more educated we are when we go in to get treatments, the easier the appointment is, the smoother it goes, and the better the expectations are set. It's all about results, expectations, and follow-up. So with these PDO threads, I've had several cases now, people contacting me with problems with threads, and I'm always happy to help people, and they contact me here on YouTube, through Instagram, or of course direct text. But recently I've noticed the trend. I'll say, okay, tell me about the case, what was done? And whether it's the patient and even the providers will say, I'll say, what kind of thread was it? It's the first most primary question, because there's many different types and no one will know. Sometimes not the provider, and the patient often doesn't know. Understand, obviously YouTube's global. We have people from all around the world here. Our number one is the United States, Canada, UK, Central America, and Australia, very commonly in India. So every country has different products. Some get FDA approval, some don't. But the common threads that you see are, number one, PDO is probably the most common. Number two, you hear PCL, polycaprolactone, and then PLLA, just like Sculptra, poly-L-lactic acid. I did have someone the other day contact me, and when they researched it, they did find out it was polypropylene, so a permanent thread. So they're still being used. So understand, know what thread you're using, know the characteristics, work with a company you trust, and when you want something changed with the thread, don't hesitate. Get a hold of the company, email them, talk to your representatives. Chances are, if you're seeing something you want adjusted or different size, the company is hearing it not just from you, but from everyone else. But to not know what's going into your body, and as a provider, understand, I test threads all the time, and I have them in test tubes and different acids and bases, and some exposed to air, all kinds of different things. But when I'm, especially overseas, and we're using threads that maybe I'm not used to or haven't seen, and we just look and test and we open the package, they might crumble. They crumble in your hand. And many of you have gotten threads where they're just not strong anymore. If they're exposed to air or different temperatures for periods of time, they're not as robust and strong. So a thread is not a thread is not a thread. It matters where you get them, what you're using, the properties. Get comfortable with what you're using. And remember, you're putting something in someone's body, and it needs to be sterile, needs to be clean, needs to be effective. Yes, it depends on technique, but the type and the way the thread is made does make a difference. Comment here. Let me know your experience, your thought. It's a community we're developing here. Without your input, it's hard to grow and to know what people want to hear, what they see. And by sharing your experience in the comment section here, you're helping everyone. Subscribe here, keep your skin and body beautiful, healthy, and vibrant.